You're listening to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partners Show. We're also on Spreaker as a podcast, so look us up there as well. Jeannie Roller is my co-host. Jeannie, today we are talking about some things that happened most recently to myself and then also to your mom as well. And these stories just keep going on and on. It's just unbelievable that this is what the reality of healthcare seems to be. So my primary care doctor is at one of those big clinics that nationally known, or I think nationally known, but certainly regionally known. And I had gotten sick back in November, and I've had this primary care doctor for five years or so, something like that. So she's got a good amount of history on me. And when I called the office up and asked to come in November when I was sick, they said, no, we don't take you. You'll have to go to an InstaMed clinic. And to be able to go to the InstaMed clinic, make sure you have 2 COVID tests to make sure, what blah, 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 blah is going on. So I said, my primary care doctor is not going to take me if I'm sick? And I was just confounded. And I'm like, so today when I went in, or this week when I went in for my annual exam, I said, I'm really confused by this. And the doctor said, yeah, that's the protocol. And I said, please explain to me what the health care actually is. The quality of care for me as the patient. If you've been my doctor for 5 years and you have, can reach out to all the other doctors that I have, also have my history, you're sending me to a strange doctor for this sickness. It wasn't an emergency. I mean, if it was an emergency, yeah, you go to the first doctor that you can get to in an ER, whatever that situation is. This wasn't an emergency. It was something that you'd go to see your family doctor for, and they would treat you for. I said, so you're sending me a doctor that I've never seen before when you have 5 years plus history of me as a patient. What's my quality of care for that? And she said, well, you know what? You're actually talking to the wrong person. You need to talk to the administration of this system. I said, so I'm talking to the wrong person as a doctor when I'm asking what my healthcare situation is? I couldn't believe it. And it just went downhill from that. And I was like astounded that that's what the healthcare is now. She said, yeah, I mean, if we had a slot a couple of weeks later, we would give you the appointment. I said, a couple of weeks later, when people are sick like that, they need to come into the office, talk with the doctor, figure it out. And, I've seen you for, umpteen times. What exactly then is a primary care doctor in this situation? And she said, maybe you need to find a doctor that practices independently. There are old-fashioned doctors still out there. And I'm like, you mean an old-fashioned doctor that gives care to his patient? Is that what we're talking about? Because I'm confused by what you're labeling as an old-fashioned doctor. So Jeannie, you just told me before we went on the air the stuff that happened to your mom. And this situation also with this clinic, when you go to have now, I think it's been the last year or two, when you go to have a CT scan or you go to have a mammogram, you have to pay a fee out of your pocket. It doesn't go to the insurance company to use their facility and to use their machinery. So if you have a mammogram at this facility, you have to pay to walk in the door and you have to pay to use whatever, machine they're going to use, MRI, CT, mammogram machine, whatever, sonogram, whatever. The insurance doesn't cover that part of it. It's a service fee, if you will, if I'm labeling in the right thing. So this is just insanity. It is. I don't know how that's legal when they've had the machine for umpteen years and how many people have used it. So now we're charging a fee to even walk in the room. If that's what they call it. It's a facility fee. And it's cash. It doesn't go on your insurance. You pay out of pocket to just walk and use their facility. So,
yeah, that's wild, Cindy. It's like if you go to a restaurant and you have a sit-down dinner, you have to pay to use the chair.
Right, and the knife and fork and the plates.
Yeah.
Well, that's what this is.
That's just wild.
Yeah.
And it's wild that they're circumventing the insurance. I mean, that is what insurance is for, healthcare. And you can't have a mammogram without the machine. So I don't get it. I simply don't get it.
Yeah, no, I don't either. But they've been doing it for a year or so now. Most of the people that I know locally have switched to other places. And that's basically what the doctor told me. You need to find an independent doctor, not concierge. Not that is part of the play too in the area that I am. But it's just astounding that a doctor will tell you that. And I said, this is actually a waste of my time and it's a waste of your time. And she said, no, it isn't a waste of my time. I'm here. I'm like, oh, okay.
Yeah. Well, yeah. And she's going to be getting paid for your visit. So she's not wasting her time. She is making money.
Right.
And that brings me to what happened with my mother, how the big insurance companies are buying up private doctor practices.
Right.
And, so you can have health insurance through a company that also owns your doctor, which to me is a conflict, but getting past that, the annual flu shots are supposed to be free for Medicare or Medicaid people. So my mother wants to go to her doctor and she gets the shot. Well, she gets the flu vaccine given to her by an MA. A few months later, she gets the bill from the doctor saying that she owns $50 for the flu shot. And so I do some searching on her insurance claims, her exclamation of benefits, and find out the insurance company wrote that off and said she doesn't pay for that. But yet this doctor's office is wanting to charge her $50, not for the vaccine itself, but for the MA to give it to her, $50 for them to put a needle in her arm. So then she calls the doctor's office and says that the insurance says, I don't owe anything for that. And they say, okay, we'll write it off. But then, that's fine. My mother is sharp. She's in her 90s. She's sharp. But then that brings to discussion how many other people, older people especially, go ahead and pay this $50 for the shot. I mean, it's just, to me, it's dishonest.
Right.
It's sneaky. And it makes me not trust them even more because of all this.
Right. And that's what I say about the facility fee. I remember talking with somebody when I went to a different radiology place, completely, private, whatever place. And they said, well, you know what, actually, we're not trying to be nasty, but one person that came to us after that whole scenario in the other clinic place was charged $1,570 to use one of their, I don't know if it was an MRI, they explained, but I didn't know what it was. I was like $1,570. And they said, yeah. They said, you're lucky that for your scan, you only had to pay $196. And I said, only $196? It's just ridiculous. So, I mean, I'm never going back to that. It's not going to happen. And most of the people that I know are not going there either. So, that's what we've talked about. Yeah, we've talked about all these years. They want to keep the patients or whatever. Well, that's not going to keep the patients. Patients are going to find other places to go. I'll find an independent doctor. In fact, I found one 20 minutes later, and I'm like, I should have done that sooner, but I didn't realize the whole conundrum of it until today. So they've been making these moves all along, and especially the last 2 years, from what I can figure out from what the doctor was talking about. And I'm like, and that doctor at one point, her own self told me she had almost 4,000 patients. Now, you tell me what the level of care I've been getting when a person has 4,000 patients in a 52 weeks a year. And she also admitted that her husband cannot stand that clinic and won't go his own self as her husband, and she's the doctor.
Yeah.
So, I mean, it's not us making it up.
It's mind-blowing that she calls a doctor who gives patient-centered care old-fashioned.
Yeah.
Like I guess they are out of style.
Yeah. Yeah.
I mean, I would think that all doctors would want to give patient-centered care.
Well, you'd think the majority would be, and there's always going to be, a rotten apple in the bunch, right? It says it spoils it for all of it. Isn't that the old fable or whatever? But I mean, now it seems like this whole scenario is a whole cluster of it. And what mindset is that? Because I said it to the nurse, too. The nurse didn't have a badge on saying like an MA or an LPN or, something like that. And I was like, this to me is a waste of your time as well. It really just is. It's not giving any care. It's not really giving any care as far as I'm concerned. And you're asking the same questions over and over and over again. And, it doesn't make sense. You should know what this is. It should be in my record. Anyway, on that note, I'm going to say, just pay attention to whatever, ask the questions beforehand, and I don't know, try to get the best care that you can. And, you're perfectly welcome to leave. Stay listening to Evergreen Media Network.